Without further ado, I'll introduce Erin Cecchi. She is our coordinator for the Center of Excellence, the Parkinson's Foundation Center of Excellence at Michigan Medicine. She is a licensed clinical social worker with over a decade of experience in healthcare, having worked some at Midwest leading institutions. Erin is a social worker at the University of Michigan Movement Disorder Program and is a cognitive consultant for Cognitive Concierge, where she helps families navigate the complexities of dementia and other neurological conditions. I'm so pleased that Erin is with us today. I'll hand it over. Thank you.
All right, wonderful. So my presentation is very much going to piggyback on Dr. Segal's in terms of, today's presentation, navigating advancing needs. And so we really introduced palliative care, supportive care as a way to help you navigate those needs along the continuum of your journey with Parkinson's. And so, she also noted that so much at the heart of palliative care and supportive care is about quality of life. So my talk is going to be brief, kind of go into ways, in conversations to get at what is quality of life and how can we act in accordance with our values to enhance quality of life. So Dr. Segal, talked about palliative care being, its own branch of medicine, right? Where you can go to a palliative care specialist virtually or in the clinic. Palliative care can also, there's palliative care agencies that can come to your home. For the next couple slides, I'm going to talk about a program that we piloted last year that's specific to Michigan Medicine, and it's our Parkinson's Supportive Care Clinic. So, we talked about there's essentially different ways to get palliative care. There's palliative care, again, specialists that you can go to in your home. So this is specific to Michigan Medicine. And again, what is supportive care, right? It is care focused on quality of life for people with Parkinson's and their family to help manage physical, emotional, practical symptoms. So that's why I have this wellness wheel, right? We care about all the aspects of your life. How do the symptoms show up and affect different areas? And how can we help navigate and manage that? Again, very much supportive care is focused on the individual with the illness and also the family and care partners involved, and very much, again, can be helpful at any stage. So again, what happens specifically during our Parkinson's care supportive visit is that you meet, again, this is specific to Michigan Medicine, but again, it's probably going to follow the format of other palliative care specialists that you may meet with. So at Michigan Medicine, you meet with a neurologist and myself. And again, the focus of the visit is what matters most to you, what's going well, what's maybe not going as well. And then we dig into ways to help improve your symptoms and life. So very much we discuss care goals, challenges, and again, we try to do this in a comfortable setting for sensitive topics. Dr. Segal mentioned inherently these can be uncomfortable conversations. And very much it's understandable that we want to avoid discomfort. At the same time, we know that a little discomfort can be good. It's where growth happens. It's where meaningful conversations happen. So again, I just encourage people to, again, not push yourself into conversations that you're not ready for or that feel too overwhelming, and yet be aware that there's a lot of meaning and value to having some of these conversations. And so again, that's why it can be helpful to meet with Dr. Segal or another palliative care specialist, or come to your neurologist, or come to our supportive care clinic, where we can, again, be very thoughtful about how and when we're talking about it, right? Having this dedicated space to talk about tough things. So again, Michigan Medicine, Parkinson's Supportive Care Clinic, we talk about symptom control, right? Pain, stress, mood, sleep, the motor, non-motor symptoms. Dr. Segal, we mentioned advanced care planning. That's, very much where we're outlining preferences for future treatments. This is also where we also often talk about healthcare power of attorney, making sure those documents are in order. While supportive and palliative care, again, is not always end of life, we often talk about, what are our wishes? Where would we like to be cared for? How would you like to be cared for? So those very much are important conversations that we have. and then very much caregiver support. So yes, the person with Parkinson's is experiencing the symptoms, they're very much affected, and we know that care partners and family members are very much as well. So in prepping for, again, a visit with the neurologist and myself, whether it be in our supportive care clinic or truly in prepping for any of your visits, it can be helpful to reflect on your current health and symptoms. What's most important to you, your goals, values, fears. Again, who do you trust in making decisions? And then to bring those questions and concerns to a visit. So again, this could be a visit specific to your neurologist. It could be a palliative care specialist. Again, it can just be helpful to think about these things to really be able to guide care and patient-centered. What may be most important to someone and that you want to prioritize is different for another. So again, it can be helpful to think about these things before visits. Right, so, and Dr. Sagal kind of talked about this, when is supportive care right for you? Anytime. And that's why we really want to stress today, navigating it is so difficult. The challenges are going to be different along the continuum of what symptoms show up, what you're experiencing. So anytime, if you're feeling overwhelmed, if you're struggling with symptoms, if you want to plan for the future, again, if you really want to dig into and focus and unpack ways to live better, not just longer, right? We are focused on quality, not necessarily quantity, although that's important as well. So again, why choose this care? Why are we focusing on it so much? Because it's so important. Because it's not giving up. It's digging into what's most important, what can honor my choices, working alongside other treatments, really focusing on your whole well-being, and it really helps you and your family live the best life that you can. So again, at the core, right, we're enhancing quality of life, and this is why values come into play, and this is why so much of the conversation that you have with a palliative care specialist or your neurologist are going to ask about what's most important to you. Because again, we know it affects more than just movement, it affects every area of your life. Right? You're making decisions about care that can be really complex. And so knowing what your values are can very much guide the choices with clarity and confidence. And so I want to call out right now some of the handouts that I was passing out as you came in. And again, there's more as you exit today, so feel free to pick them up. But specifically, the handout, Resources for Living Well and Planning Ahead, that lists various websites and a book that you can go to kind of suss out what is most important to you, right? So sometimes it's like, where do I even start this conversation? So there's a lot of guides and great material online and included in some of these guides referenced that can help you kind of, again, suss out what matters most, what do I prioritize, what are my hopes, what are my fears, as this really can help to direct care. Again, so values discovery questions, again, very much innate in a lot of those resources mentioned, but it can be just helpful to reflect on what brings me joy or peace, what do I want to keep doing, what worries me most, what does a good day look like? For the caregiver to reflect on what matters most and how I support my loved one. What support do you need as a caregiver? What does quality of life mean for both of us? So again, this is just a sample, values discovery questions. There's so many prompts online that you can use to help you, again, what do you value and how do you want to act and take steps to live a valued life? So living your values and what matters most activity. So this is in reference to another handout that I provided. It's the one that's stapled, so it's multi-paged. So this is, again, an activity that you can do. So I just wanted to take today to introduce the activity. We're not going to go through it because, again, it can be emotionally laden. So I think it is very important to have these conversations in a thoughtful manner, in a place that you feel comfortable, in the headspace where you're, okay to kind of dig into some of these more, thoughtful, reflective things. So this activity, again, helps individuals explore values, identity, what matters most, and then create actionable steps to live in alignment with those priorities. So again, this is just one activity that I wanted to provide you to be able to have these conversations and guide care. Oftentimes, right, there's a value of, let's say, nature, and maybe Parkinson's makes it more difficult to go out into nature. So we talk through, well, how can I still live in a way that values nature? Can I sit outside? Can I make specific time? Maybe I can't do my 10-mile hike I used to, but is there a way that I can action on this value? Maybe I can't go out to the restaurants. I love connection. I love being social. Well, maybe, going out as much as you did is not feasible. Can I schedule weekly calls with a friend? So again, so some component of this is also engaging in a little bit of, kind of creative brainstorming and troubleshooting. Like, what action would fulfill this value? Who can I gather in my support system to help me as well? Again, an optional tool. There's so many wonderful values worksheets available online. Sometimes it can be when someone asks you, what do you value most? It's like, everything, family, but what does that look like? So these, if you do an internet search for core values worksheets, so many can come up, and then it can kind of allow you to reflect. Sometimes it's easy to circle a word, oh yeah, I really resonate with that, and then be able to further think, okay, what do I want to do in my daily life that honors this value? What's a small act that I can engage in? So key takeaways. Again, my presentation was very short. I just wanted to, again, kind of provide some reflections and prompts for then you all to take to your, self-reflect, take to your family members, take to your neurologist or your palliative care professionals to be able to, further engage and guide these conversations. So, right, values-based care puts you at the center. And conversations like this help individuals stay connected. It's kind of, we talked about, or Dr. Sagel talked about, palliative care, we can kind of, it helps us kind of develop a roadmap. So I think what's really helpful is incorporating the values is that can kind of guide us. Like, what do we want to guide us on this journey, on this road? And again, worksheets like the care guide I mentioned and a lot of the websites are guides just to help you. Again, right? There's big conversations to be had when it comes to talking about the future. So these can kind of help narrow and provide finite questions and reflections to help you as you're exploring and engaging in these important conversations. So again, we very much have time for questions. I know it was a lot, but I just wanted to impact in a short amount of time, but again, wanted to prompt reflection that, you can take to your own providers and families. But any questions?
So I actually have a question maybe to get us started. When you talk about sort of having these conversations with family or physicians, it sounded to me like you weren't saying this is like a conversation, but this may be like ongoing discussions across?
Yes, very, very much so. So thank you so much. So, right, you may be having a finite visit with a provider, but you can see these providers multiple times. And again, right, just like your needs change, the conversation is going to change accordingly. So what's most important at one point, your priority is going to change. What you value the most at one point can change. So yes, this very much does beg multiple conversations. So it's not like a one and done, hey, we're going to get all this planning, because like that's heavy. So it does help to parse these things out, and very much like inherent, it is emotional. So please very much like set your own pace, be aware, is this becoming too overwhelming? Do I, maybe even if it's valuable and my provider says I should do this, like, is this something that is resonating with me as important right now? So yes, very much, have these conversations continually, right? We talk about like, at the beginning, along the course of, your journey, when new symptoms, when maybe care needs change, when an event happens, can kind of prompt us, okay, like where are we at with things? What do I need? So again, very much, yes. Thank you, Laura.
You mentioned it was a pilot. Is that something that is going to be utilized in other Parkinson's Centers of Excellence?
Yeah, so Dr. Fern and I, again, specific at Michigan Medicine just last year, the neurologist Dr. Fern and I started seeing folks virtually for an hour visit where we're meeting with individuals and family members and kind of digging into these conversations. We're going to continue it as far as I know. And again, we have Dr. Sagel, now here too. So I think part of the conversation will be how does her neuropalliative specialty fit in with what Dr. Fern and I are doing. Again, this is very specific to Michigan Medicine. So many other centers of excellence across the country have neuropalliative specialists built in, or they have palliative care physicians that they refer to. So yeah, Dr. Fern and I's specific supportive care clinic that's virtual is specific to Michigan Medicine. But honestly, I feel like there's iterations of this across the country at different centers of excellence. So it may not exactly be like ours, but again, I think you can have these conversations with your current providers, or again, they're going to be connected to different palliative care specialists.
Do we have other questions for Erin?
Well, again, thank you so much. I will absolutely be around, afterwards if you want to chat one-on-one. And again, I am available to any of the Michigan Medicine patients, so you can always, ask for a referral to me. I'm often having conversations and do family visits, via in person at East Ann Arbor or virtually, where we're, again, maybe can dig into certain aspects of, again, what's going well, what's maybe more challenging, and then how do we support you in that, whether it's emotionally, practically, connection to resources, what have you. So, and again, if it's not me, if you're not connected to Michigan Medicine, often larger clinics are connected to a clinical social worker. So you can always ask your neurologist about that. Okay. Again, thank you so much.